Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. Now, before I start, I would like to acknowledge the traditional custodians of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders, past, present, and emerging. Well, we've done many programs on doctors' health and we have looked at burnout as a problem in healthcare rather soberingly through the episode we did with oncologist Dr. Tabitha Healy, who is now a health coach to doctors. She shared with us a rather disturbing statistic that 44% of doctors and 60% of nurses are suffering from burnout. And burnout is characterized by being disengaged, by feeling ineffective, and also experiencing exhaustion. And that's rather sobering when you think that these are the people that are delivering our health service. But then when you think about the tsunami of preventable chronic degenerative diseases that they are having to contend with, and when you think about the fact that they also would be seeing 30, 40 or 50 patients a day, or if they're working in hospitals, they could be doing very long shifts, then it's not entirely surprising, and it's also not surprising that as a result of all of that, we have a pharmaceutical industry worth 1.5 trillion US dollars, which equates to about 2.5 trillion Australian dollars. Rather sobering, and the medical profession has facilitated that very successful industry. But it comes at a price. And practicing medicine in one way is the price that many medical practitioners pay for that, but there is an alternate way, and I've highlighted that with many practitioners over the years and many specialists who take an integrative, holistic, functional approach to disease, looking not just at writing out a prescription and taking a symptom-based approach, but looking at cause. And that happens to be a far more rewarding and healthier way for medical practitioners to practice. Well, my guest today has gone through the full gamut of that. My guest is Dr. Shami Barathan, and Shami graduated from the Imperial College School of Medicine in London in 2000 and worked in the United Kingdom and New Zealand before settling in Melbourne, Australia, and she shares that journey with us. She has over 22 years of experience and has specialised now in nutritional and environmental medicine and has completed a fellowship with the Australasian College of Nutritional and Environmental Medicine. She also has a fellowship from the Royal College of General Practitioners, and in 2021 she was actually Vice President of the College ACNEM. Now, we go through that journey and discuss a whole range of issues with Shami. I hope you enjoy this conversation I had with Dr. Shami Barathan. Welcome to the show, Shami.
Thank you, Ron. It's so awesome to be here. I'm very honoured, by the way.
Well, it's a pleasure. It's a pleasure. I've been looking forward to having you on as a guest. I know that you've been on a journey. We've met through the Australasian College of Nutritional and Environmental Medicine, which we're both on the boards of, and we've done all their courses. That is ACNEM. And I was always really taken by your own professional journey, but I know that you describe yourself as an integrative doctor. Tell me when you say that to people and they go, "What's that?" Well, tell us, what's that?
That is awesome. I get that asked all the time from patients, and it's really interesting. So what I normally say is, like, when you go to your GP at the moment, you present yourself with a couple of symptoms, and more often than not, the solution is in the form of a drug. However, when you come to an integrative doctor, we want to hear all of your symptoms because often it's all connected. We deep dive, we want to find the root cause to get you back to wellness. And we work really holistically, not only from maybe perhaps nutrient deficiencies, nutrition, lifestyle, stress. I'm a big advocate for how stress affects the body. So we work really holistically in a step-by-step fashion to get you back to wellness. So that's the key difference.
Mm. And of course, it's interesting to hear you say that typically a pharmaceutical solution would be found for your problem. And it's for that very reason that I think, well, I don't think I know, we have a $1.5 trillion pharmaceutical industry, which is supported by that kind of medicine. But I know you were on a professional journey yourself because you once were that doctor. Tell us a little bit about what I'm always intrigued about about why a doctor would make the transition from the way I think it's fair to say 80% at least of the medical profession practice in this fashion to becoming an integrative doctor. And I know you've gone on that journey yourself, so maybe you will give us insights into that. Tell us a little bit about your own journey.
Absolutely. So I get it that we are trained to prescribe medicine because when you really look back at med school, the training is focused around pharmacology, which is study of drugs, medication. We've focused on you've got an illness, how do I treat that with a drug? And when I really look back, I can't recall any education on nutrition. Yes, we learned about what happens if you're really vitamin C deficient, so you've got scurvy on the worst case scenarios, but we never learned what the basics of nutrition that we need to use in order to thrive, or even lifestyle medicine. I can't remember learning about sleep and movement. I just cannot recall. It was very focused on pharmacology. So I get it. We graduate, and this is what we're trained to do. We're trained to diagnose, we're trained to manage with medication. So when I started that journey, you do come out feeling very overwhelmed. There's a ton of information that you're actually trying to process and learn and stay safe and follow those protocols, follow those guidelines. Plus, you're doing so many hours of work. When I graduated in 2000, at that time, this is back in the UK, we would do 48-hour on calls. We would do 36-hour on calls, and perhaps we would sleep for maybe 4 hours on a 36-hour on call. It's almost unheard of. So can you imagine just doing those hours? You're sleep deprived, you're exhausted. At the same time, you're going, right, I've got a patient in front of me. I need to be alert. I need to stay safe. What do I need to do? And it's that kind of intensity and pressure most junior doctors are under. So I get it why we're not thinking differently. I get it why we just want to follow this protocol. We want to stay safe. We want to do the best we can. And the system is designed to do that. However, as we're both going to talk about, doctors reach burnout very quickly, and it makes so much sense. So in my journey, I did do my basic training in the UK, but I needed time out after that, went to New Zealand for a year, went to Australia for 6 months, went back to the UK and started the journey of training to be a GP. But at so many points in my training, I was disillusioned. And at so many points, I needed to take time out. It was a decision that I made. So I completed my GP training. And again, I kind of looked at what I was doing. It's like, hold on a sec, I should be really happy. Completed my GP training. Yeah, I've got my home, got my car, I've got my lifestyle, but why am I not happy? And every day, just to give you an outline of what GP life is in the UK. So when you get a job as a GP in the UK, you're actually allocated patients. Patients are not allowed to sort of go to a practice, say 10 kilometers away. They are allocated practice based on where they live. So doctors are allocated, say 1,200 patients, and that becomes yours to manage. That means you do everything for that group of patients. So they want home visits, they want scripts, they want queries. This is what you're dealing with. That means, just to give you an idea, on average 40 to 50 consults a day.
Wow.
That's 40 to 50 interactions that you're going from one to another, opening notes, trying to gather your ideas for this patient, scripting, answering queries. It's never ending. And until this day, and I hear my colleagues still saying, they're still doing 12 to 14-hour days. And these are...
And you in hospital, I mean, this rolled off the tongue, and I wanted to just you to repeat it. You were doing 48-hour or 36-hour on-call sessions. So this is rather sobering to think, you rushed into hospital and the very person who you're putting your faith in, which I'm very grateful for them, don't get me wrong, is
Yeah.
someone who themselves is incredibly tired and incredibly stressed.
Absolutely, absolutely. I'm hoping that's changed. I mean, in the years when I was going up the ranks in medicine, it did change. There was it's a level moving on to shift work, and I have a feeling that's happening in Australia, but that's what we were dealing with. Exhausted.
But you were commenting that you were seeing 40 or 50 patients a day, and I can give you an update because we recently did a program with oncologist turned executive coach, Dr. Tabitha Healy, who quoted a figure, current figure, 2024 figure, that 44% of doctors and 60% of nurses suffering from burnout, which is characterized by disengagement, feeling ineffective, and being exhausted. That's what characterizes burnout. So that's the update, Shami. I mean, that's pretty, 40 or 50 patients a day is mind-boggling. Go on, tell us a little bit where we're at there, because that doesn't leave a lot of time per patient, does it?
Absolutely. And that kind of leads me on to just explain. So, what does that look like?
Mm.
Patient comes in 6, 7 minutes later, they're walking out with a script. And when I really look back, we actually celebrated that. We go, wow, you're keeping to time, you're getting through all these queries. Patients loved it. They came in, they came out, they got what they wanted, which was a script. But I always stopped and thought, what exactly am I doing? How am I helping them? Because I was literally prescribing. I didn't get a chance to get to know them. I didn't get a chance to even say, how's your life going? Because all of this is impacting their health. And I was literally prescribing patient after patient. I actually thought I was a robot. I really
Wow.
felt a
Yeah.
robot. And so around 2010, 28, I took some time out, went around the world. I was disillusioned. I needed time out from medicine. So I took some time out, traveled, came back, and then the idea of coming back to Australia came into the picture. And it was just fortunate. Things led to one thing led to another, and I found a job in Melbourne, and it was a GP practice. And it was almost like a holiday run coming from the NHS to Australia because I realized I could give more time to patients. And that was incredible. There was this luxury of time which I never had before. And all of a sudden, my consultation changed. So I was having more time to ask about them and really dive into their lives because everything matters. When someone presents in front of you, there's a story that leads to that presentation. So I was enjoying that. I was enjoying that time. But again, it was all about the solution in a drug. And it was so interesting. Luckily, a good friend of mine, a mentor, we went to the same university, Dr. Amy Gadger, who many people may know, and another amazing integrative GP, introduced me to ACNIM, the College of Environmental Medicine. And I just started learning the foundation. And when I started doing that, I was blown away. I was thinking, why wasn't this taught in med school? I felt like I was relearning medicine. This is the kind of medicine I really wanted to practice, which is about wellness. How do I get a patient from illness to wellness? And this is what the body's meant to and was designed to do. And then you get addicted. As you know, Ron, you get addicted. You never stop studying. And you still don't. And
You
you just
do. That's right.
all the way up to fellowship. And that's when I started shifting my consults because it was so evident that patients were getting better with this philosophy, this way of consulting.
It's interesting because I know, well, you said that in the UK, your average consult time for 40 or 50 patients a day would be 6 or 7 minutes. And then you came to Australia and you had, because I know the average consult time in Australia is 10 to 15 minutes. Oh my God, what a luxury. It's interesting, it's sobering perhaps for the listener who may not know this, but the regulatory body in Australia is called APRA. And I don't think there are many doctors that are brought before APRA for prescribing too many medications. But I do know that there are many doctors who are called before the regulatory bodies if their consultations are longer than they should be, which is 10 to 15 minutes. And if they're ordering tests, God forbid, things like vitamin D testing, that's something that the regulatory body would draw. I mean, this is kind of part of the system, isn't it?
Absolutely. And I've experienced everything that you've said. You're absolutely right. You can't do too many consults, long consults, because you will be audited. And I'm aware of doctors being audited because they were offering longer consults.
Spending too long with your patient. I mean, you might actually find out what the cause is.
Absolutely. And also, I was one of the doctors who got the letter about ordering vitamin D.
Mm-hmm.
And as a result, I had to change my practice that, vitamin D is a private test now. And so you are actually working amongst all of these constraints in the attempt to provide amazing service and providing education and wellness. Absolutely.
Because you talk about treating the problem, whereas really what I think most medications do is manage the problem. And I know that's just that we're not just talking semantics here. There's a difference between treating a problem than managing it, isn't it?
Absolutely. And I would love to give an example of just mental health.
Yeah, go on, do.
Mental health, and I see this all the time, how it's so quick in our system to go, right, you've come to the doctor, maybe you're going through a few life challenges, and the first thing the doctor suggests is an antidepressant. But what exactly is that antidepressant doing? It's numbing you. It literally is just numbing you from feeling the emotion. However, we know, and there is a ton of evidence out there, how nutrition affects mental health. And I know you've had Georgia Eid on one of your.
Well, Julia Ruckledge, actually.
Julia
Julia Ruckledge.
Ruckledge. Oh,
Yes,
yes,
I'm
yes.
getting, we'll get Georgia on, but Julia Ruckledge, professor of psychology at Canterbury University in New Zealand. Yes.
Yeah, and so much evidence how important what you're eating is affecting how you feel. And also, what about movement? What about sleep hygiene? What about blue light toxicity? Now, often this is not addressed, but I go even deeper. What about your social connections? What about your community? Laughter, how you actually live on a day-to-day basis, and how that has a massive impact on your mental health. And I always look back and say, wow, I was one of those doctors that I did prescribe an antidepressant without asking about all of these factors, when we know for a fact this has a massive impact. And it can never be just about the drug. It can never be, because that doesn't solve all your other issues when it comes to anxiety and depression. So absolutely, Ron, it can never be just about the drug. It's just one tiny, tiny piece of the puzzle.
And it's sobering to know, because we've done a few programs on antidepressants, that 1 in 6 Australians are on antidepressants, and they are extremely difficult to come off if you've been on them for any length of time.
Absolutely, absolutely. And I had an amazing chat with Dr. Joseph Witt-Doering, and I don't know if many people know, he's the founder of the Taper Clinic. He's actually an Australian psychiatrist, but moved to the States, and he was also part of the FDA. He was looking into drug safety, and he was always questioned the use of antidepressants. And I think, our listeners should follow him and get the right message, because you're absolutely right. We don't talk about the rare side effects of antidepressants, which are disabling, which can last many, many, many years. And he's amazing.
What's his name again?
Dr. Joseph Witt-Doering. And he's the founder of the Taper Clinic. So on Instagram, it's the Taper Clinic as well. And he's one of very, very, very few psychiatrists, just like Georgia Eid, who are speaking out that mental health is just more than just a pill. And that's when we're not getting to the root cause.
Well, we have done recently a program with another psychiatrist, Professor Mark Horowitz, who is also very much from his own personal and professional experience about coming off these medications, which, according to the authorities, should take 6 to 8 weeks. But in his personal experience, it took more like years to come off, and that is quite a challenge. I know you've already mentioned you're based in Melbourne, and Melbourne was really the epicenter of the lockdown mentality. I think there was no city in the world that was locked down more than Melbourne. So you will have seen, what's your reflection of that time as an integrative doctor in Melbourne at the time? What's your reflection on that?
Absolutely. When I really think back, Ron, I almost think, how did we get through it? How did we survive? It was an unbelievable time. And wow, when I really think back, I almost need to sort of take a moment and see, just reflect and go, it affected us mentally. There is no doubt. No matter how well you thought you got your mental health together, it affected everyone. When you really think about, taking away that freedom, that 5 kilometer, that 8 p.m. rules, just not seeing other people, that isolation, that being, told to go out only 1 hour a day for sunlight, that's everything to make someone anxious and depressed. And I often say to patients, think about what happened during COVID. Everything that you were told not to do is all about human self-regulation. And literally that was taken away from you. So you need to connect, you need to hug, you need to see smiles, you need to laugh, you need to experience new things, you need to socialize. It's unbelievable actually what we went through. And I don't think many, to be honest, not even many people living in other parts of Australia realized the impact it had on the Melburnians, because it was so different to every part of Australia. And almost makes me really think, is this the same country? Like, did we experience, were we in this together? It was definitely, Melbourne was on its own race. The level of restrictions was unbelievable. And as a GP, I saw it from the other end of mental health. Mental health skyrocketed. And I'm talking, my patients who were young teenagers who got it together, but during that time, all of a sudden, eating disorders propped up, severe depression, suicidal ideation propped up as well. The rates were sky high. Luckily, as a health professional, I had a level of normality of going to work, going somewhere different. I wasn't, working just from home. I was able to go to work. I was able to see people. I was able to interact. But so many of my patients were living on their own, suffered the most, and it was just phenomenal. And I actually feel till this day there are still side effects from it with anxiety. I was hearing teenagers suffering from anxiety that they never thought they would suffer from. Parents would say, oh, I thought my child was okay, but during COVID the social anxiety skyrocketed, and they're still feeling the effects, because then they had to change schools and they had to get psychology for help. And it was actually a lot more to it than we think.
Yeah, yeah. I mean, I know that before the pandemic, we'd done a program with another psychologist, Jodie Lowinger from the Sydney Anxiety Clinic. And pre-pandemic, she shared with us that 1 in 4 teenagers under the age of 18 are diagnosed with anxiety or depression. And that's a kind of staggering pre-pandemic
Yeah,
statistic. I can only imagine from your observation where
yeah,
that statistic would sit today.
absolutely, absolutely. And then it would add it on with staying indoors, lack of sunlight, and blue light toxicity. All of that would have just escalated the level of mental health.
Hmm. Now, stress, you mentioned, stress
Mm.
is something that you see a lot of. You obviously, I'm interested to know how you seeing stress manifesting itself in a patient.
So interesting you say that, because yes, I started the journey with acne, and yes, we talked about nutrients, we talked about lifestyle, we talked about nutrition, but there was something actually missing in that picture, which I was noticing in my friends, and it was the impact, noticing in my patients was just the impact of stress. So I always wondered, why are you coming to me with these symptoms and not someone else? What was different in your story? And we looked at the stress impact. So that's great. Yes, there was an element of stress, but also I took it to another level in my research of why some people perceive this as stress and they can get on with it, and why some people take it on. So that's when I went to another level. I'd love to chat to you
Yeah,
about it.
yeah.
So stress affects the body. We know it does. There's so much research out there. And when I really observed what I was seeing, 80% of my consults were related to stress. For example, like you've got a cold or a cough and you come to see your GP, just think about the days leading up to it. Have you been working hard, exam stress, lack of sleep, under a lot of pressure? We know the evidence is there. Immunity is affected by stress. Sleep affects immunity. Poor diet affects immunity. So there's a whole series of events that take place, which is due to stress that leads to poor immunity. And we know stress increases cortisol, which equals sugar. And I always say that to patients, cortisol equals sugar. So that's released, and that means it leads to weight gain. And many, many patients are suffering from gut disorders such as irritable bowel syndrome. And we know there's a mind-gut connection there, and that's another stress impact. But we actually see stress affecting the gut in so many different ways. And it's quite amazing in the integrative world when patients have tried to find a solution to, for example, indigestion or bloating or wind. So they've ruled out all the major causes that most of us are worried about, but they still have the symptoms. And that's when we go back to that stress response. And it's phenomenal when they've addressed it that these symptoms actually go away. So stress appears in so many forms in a normal GP consult.
I know many people look at stress or view stress, they almost wear it as a badge of honor. Oh, I'm so stressed. I'm just so stressed.
Yeah.
But I mean, I've found a very good, you've mentioned immune function as one impact of stress. I would add chronic inflammation as well. Anything that you encounter that compromises your immune system or promotes chronic inflammation, to me, is a stressor. Um,
Spot on.
yeah, yeah, and so I guess part of it is awareness, isn't it? I mean, education.
Absolutely. And I think this is a great topic. We've normalized it. We love saying stress. It is a badge of honor. For example, in the corporate world, you're working later, you're staying on late, you're coming in early. That whole sense of stress is celebrated. And almost if you didn't say it, it's a sign of like laziness, or you're not keeping up to what everyone else is doing. So it's in our societal language now. It's in the narrative. We've normalized it, but we've celebrated it. But no one's talking about the damage it's doing internally to you. And you may be walking around with such high blood pressure that you may not know. You may be walking around with saying, great, I'm just going to deal with my gut issues, but and not realizing the impact on health. So the problem with stress and the chronic conditions it has, people are managing. They're saying it's okay. They're not wanting to say, actually, I want to thrive. I just don't want to survive. Actually, I don't want to deal with bloating. I actually don't want to deal with poor sleep. I'm tired of feeling tired. And that's what I hear a lot finally when they come to the journey to an integrative GP. There is a tipping point of saying, I don't want to feel like this anymore. And that is key. But it's a choice. It's a choice that you take of deciding like when you want to do something about it. There has to be a pain point for you to take action.
And I mean, I think the same happens for doctors too in their own lives, isn't it, really? I mean, I'm still coming back to, why would you choose to change the way you practiced? Or why wouldn't you? What would you say to somebody who was in this where you once were and is kind of frustrated with it? What advice would you give for a doctor, who's at that pivotal point in their lives, one of the 44% who are burning out?
I always ask that question myself, and I have this discussion with my colleagues. They complain about it. They complain about the long hours. They complain about the pressure. They complain about the admin. But where is the conversation about a solution? And that's not talked about. And it actually amazes me. And I actually think it's because they are burnt out. When you're burnt out, you don't have capacity to find a solution. You don't have capacity to think. You're literally in survival mode. The survival mode is to get up on Monday morning, get to your clinic, see those 30 patients, and you're on repeat. You're on repeat for 5 to 6 days, because the survival is, I need to pay the mortgage. I need to get my, pay my kids' private schools. I need to get through this. And you're in survival mode. There is absolutely no time to stop and think, can this be done differently? In order to be thinking about solutions, you actually need to have a clear headspace. You actually need to have time to think about solutions. And actual fact, there is no time in that 6-day week because you're so exhausted. So often that's number one. Number one is that you're too tired to even think of a solution to get around it. Number two is actually you've normalized this. You actually believe that there is no change. There is no possibility of a change because that's the way it is. And you kind of see your colleagues doing exactly the same. You're seeing other clinics doing exactly the same. You meet people at conferences. Everyone is experiencing stress and you think that's how it is. I actually have to tell a really quick story here.
Sure.
My sister is a doctor in the UK and she experienced such high stress, this was years ago, that ended up in hospital with chest pain. Luckily, nothing was, it was absolutely fine. She was absolutely fine, but it was a pivoting moment for her in her life. And guess what? She went to her GP and mentioned the stress that she was under. And I remember to this day that her GP said, well, aren't we all going through it? And I was so shocked that as colleagues, as our peers, we are not doing anything about it. So we think this is the only way of practicing, but there are so many other solutions. So what advice would I give is there is another way, and there's a way that you can do it, meeting all the regulations. We've just got to start having that conversation. But the first thing is you've got to stop what you're doing and you've got to look after yourself. Like self-care is so important, and you've got to first take time out for you to suddenly realize that there could be a better way.
I know you've mentioned sleep a few times there, and I'm often surprised when I've taken a medical history of the number of people who are on antidepressants, and yet no one has asked them about the quantity and quality of their sleep. And I think this is part of the problem. If the doctor themselves don't take it seriously, then they won't include that into their patient assessment.
Absolutely. So if you don't experience what thriving means or
Yes.
living, that vitality and, to being able to wake up and go, I'm excited about the day. I'm passionate about what I do and I'm loving the way I'm leading life. If you don't feel that, you actually don't feel it's possible. And if you don't make the changes of what an amazing night of sleep is and how you feel the next day, you just don't believe that it's actually important. So it's not a priority to ask. And so we keep going down this whole spiral of next medication. Great. Okay, you've got side effects, let's change it. And you just keep working on that without realizing once you get the basics and foundation right, you can actually feel better. And you're spot on, Ron. You've got to feel it. You've got to feel that difference of lifestyle and nutritional medicine to actually be able to advocate it. And I always get it. Actually, a lot of friends who are not doctors would say, Shami, I'm not really going to believe a doctor who's overweight for them to give me advice. I'm not going to believe a doctor who looks so run down and burnt out to give me advice about health. And I go, do you know what? I get that. Because if I'm going to give advice, I have to practice what I preach as well.
Yes. Another one you've mentioned and we've explored is blue light. And you've mentioned it a couple of times. What are you seeing as the problem with blue light? And how do you advise your patients to deal with that?
Yeah, thanks to the work I've got to mention his name, Dr. Max Gelhan. He's amazing.
Yes, we've
He's a
had Max on the program.
He's a GP in Albury, just highlighting
Yep.
this is another missing piece of the puzzle. So you go on this beautiful integrative journey. Yes, you learn about nutrients, you learn about gut health, you learn about hormones, stress, lifestyle, and he is absolutely spot on. We've missed out light. We missed out the benefits of light. And as human beings, we rely on it to survive. And it's really interesting. We are missing a massive piece of the puzzle here of illness. And I now advise every single patient who's got a desk job, who's sitting in front of screens the whole day, who's probably spending the evening watching TV or on their screens, the impact of blue light on your health. And blue light increases cortisol, it increases insulin, it affects the pituitary gland. You need UV light to produce T3, which is a thyroid hormone. So just imagine what you're doing on a daily basis when you're spending 12 to 14 hours. You're also depleting dopamine. So can you imagine what you're doing without you realizing? It looks so harmless, but in fact, it's affecting your health. And it's really, really interesting is when you've explored every other aspect of health, you have got to look at blue light and what it's doing. And when I see patients now and they've made those simple changes, they feel amazing. Suddenly sleep is better. Suddenly they're losing weight. Suddenly they're less anxious. Suddenly they're less inclined to scroll or look for sugar because they're not dopamine depleted. So it's something that we're not talking about enough. And thanks to doctors like Max Gallhan really promoting that, and we need to speak about it, because our work is mainly now, when you think about it, majority of my patients work indoors. Majority are in front of a computer at the same time they've got chronic diseases. So we've got to connect the dots.
So I mean, they're not going to give up their jobs and probably
Yeah.
not going to give up. So what should they be doing? How should they be approaching it?
Yeah, absolutely. So I get them to do three things. One of them is, it's actually a software that you can download. It's called iristech.co, onto their laptop, iristch.co. That actually blocks blue light. It's very cost effective for lifetime subscription. So it gives you this yellowish tinge. So automatically you've prevented that. Next thing is blue light blocking glasses. They do work. And the next thing is, start the morning. The first thing you do in the morning before you pick up, fantastic. Fantastic.
For those that are just listening to this, I've just put my blue blocker glasses on. That's okay. I'll put them off now just for the moment. But go on.
The first thing you do before you pick any phone, do anything, just open that window, open that door, go and sit in the morning sun. That's the most amount of red light, infrared. And we are deprived. We're deprived of it. And so that three simple things that can transform how you feel in the day.
And another public health example of demonizing the sunlight, which I think it is fair to say has given us life. But the apparent, okay, our devices are no problem at all. In fact, I think we were talking last week about the fact that Wi-Fi radiation was classified by the WHO, the World Health Organization, in 2011 as a Class 2B carcinogen. Class 1 means it definitely causes cancer. Class 2A means it probably causes cancer. And Class 2B is it possibly causes cancer. And I don't think we're ever going to read very much about that in our media because so much of our media depends on us looking at those devices. It's not good for the business model, but that's the fact. I mean, it's Class 2B carcinogen. We need to approach it with a good deal of respect, cautious respect.
I'm so glad you brought it up, because that's another thing we've got to really think about. We're bathing ourselves in EMF. Most people don't turn off EMF at night. And so we're never allowing our body to rest from exposure to EMF. Where, think about it, you're in the car, you've got Bluetooth on. You go into a building, everywhere has Wi-Fi. You've got your phones attached to you all the time. So when are you actually allowing your body and mind to not be exposed to EMF? So the key thing is, just at night, turn it off at the router, turn your phones into airplane mode, no devices around the bedroom. Almost keep that sleep, going back to sleep, keeping sleep is the most sacred part of the day. And I have to share a story with you. Just recently, one of my patients told me the most scary story. She's thriving in her business. She's doing really well. She's so excited. And obviously she came to me with a few symptoms. And then I asked about her sleep. And she goes, oh, yeah, Shami, I go to bed at 11, but I wake up at 1 in the morning. I'm so alert. And then I work on my computer for 5 hours. And then maybe I'll go to sleep at 6 for an hour. And then I'm back again. I'm just so excited about my business. It's doing really well. And my jaw dropped. Yes. You can imagine how I looked at her, go, are you serious? How long have you been doing this for? You're chronically sleep deprived.
Yeah.
And guess what? She ended up in hospital with severe vertigo. And then she ended up with another episode of vertigo that she could not drive, could not move for a couple of hours. And I always say to patients, at some point, your body's going to give. Sleep is the most important part of the day. It's there for a reason, to keep you alive, and you can't actually survive without it. And it will come out in other forms until you are listening. And so now she stopped, she can't work, she has to review that. But it's amazing how we push ourselves to the limit until something really awful has to happen for you to stop and think, let's just get our basics right.
Yes, yes. Well, it's interesting because I think in sleep, the people that sleep, I mean, 90% of us need 7 to 9 hours, but people who sleep 3 to 4, 5 hours a night perform really badly on almost every health measure, physical and mental. It's the group that sleeps 6 hours a night that are the most interesting because they think they're getting enough sleep, but they perform just as badly as the 3 to 5 hour group. And I know that because I was once that person. I used to, until I
Yeah.
took sleep seriously 20 plus years ago, I was that person. Oh, I get to bed at 12. I get all my best work done between
Yes.
11 and 1, and my kids are asleep. And yes, I'm up at 6 o'clock and off to work and blah, blah, blah. And then eventually something happens and it alerts you to it. It's just this, again, like stress, this normalization of dysfunctional behavior.
Absolutely. It's almost like we think, we're invincible. We can push boundaries, but at some point the body will let you know that the boundary has been pushed and you have to do something about it. And it's just really interesting. Like another patient came to me. She was going through a lot of stress in his marriage, and he was actually quite afraid to come and see a doctor because he was afraid of being judged because the issue was him in the marriage. And he actually came with a different issue. He actually said, "Oh no, I'm worried about my kidneys. I'm seeing a specialist." And I go, "When was the last time you checked your blood pressure?" Ron, you would not believe how high his blood pressure was. It was so high, I had to send him into hospital.
Wow.
And he was monitored for a couple of hours. And he was walking around, he was slim, he looked well, he was having this high flying job, he was functioning, he was happy, he was so-called happy. And he was walking around with such high blood pressure. But it took him at that point to suddenly go, well, actually, I am feeling the stress. I actually need to do something about it. I'm not doing something about the level of stress I'm under. So it's very easy to suppress, really easy to suppress. It's easy to put on this amazing sort of look and go, I'm looking great. I'm functioning, I'm doing okay at work, but I'm internalizing this such level of stress that he could have had a heart attack, he could have had a stroke. No
Hmm.
doubt.
How old was he?
He was in his late 40s.
Late 40s. Yeah, looking fit and healthy, not, apart from not being.
Absolutely. And it really shocked him. It shocked me because are you walking around with this high blood pressure? How long has this been going on for? And something has to change. And it's something about a story about community. When I asked him, who would you like to go to the hospital with? He goes, I don't have anyone. I don't talk to anyone about stress. I keep this all close together. And that's another issue in society at the moment, the lack of community, the lack of support.
Yeah. And what would have been some of the things that I mean, suggested for him?
So, funnily enough, the first thing was the level of coffee he was drinking, the
Right.
amount of coffee he was drinking every day to get through the day. But also just addressing the awareness what stress was doing to his body. And he
Yeah.
wasn't aware because he was functioning. He was thriving at work. He was getting through marital issues. He was seeing a marital counselor. But I go, where are we going to get you the support? And then we talked about deep breathing, nutrition, sleep. I gave him a couple of strategies, but the key thing is he needed to be medicated, and we were going to work on that as well. But where is his support? How is he actually going to deal with internalizing stress?
Mm-hmm. I mean, there are so many avenues into this, aren't there? Depending on your own focus. So in terms of your experience in, well, stress. You mentioned also about stress impacting on cortisol and sugar, and a lot of people don't actually associate stress with diabetes and obesity. Share with us a little bit about that.
Absolutely. So when you think about stress, what actually is happening to your body? It's generating a whole series of reactions, but most importantly, it's releasing that cortisol, it's that stress hormone. The whole idea is to get you out of a difficult situation. So it's designed to release a bit of sugar to go, right, we've got to get you running out of here, get it moving you from a fearful situation. However, in today's world, the fear is very emotional. It could be embarrassment, it could be fear of speaking, fear of carrying out a meeting. And that triggers the same fight or flight response, which releases cortisol, which tells your body to release sugar. So that's glucose. And so what happens when the body reads it as glucose, it's as though you're eating, it's as though you've had a meal, and the body processes it in the same way. So what happens, insulin's released, and insulin is your hormone that tells your body to store fat. So this whole journey happens. So you could be sitting, not eating, but at the same time in high stress mode, releasing that cortisol, mimicking as though you've just had junk food. That's how I explain it.
Hmm. Yeah. And I'm just intrigued to know what your day as a integrative doctor, because you mentioned 40 or 50 or more patients a day in the old days. What does a typical day in Dr. Shami's life look like in terms of patient loads?
Absolutely. So at the moment, I only need to work 3.5 days. I just want to make that point. So I've always prioritized self-care. So Mondays and
Yes.
Tuesdays are self-care days, and I've got so many other hobbies, and socializing, having a connection with friends is so important to me. And on those 3.5 days, I've split it. So I've got 2 half days and 2 full days. But in those 2 full days, I see patients in the clinic, and it's half-an-hour appointments, and it's mixed in with 15-minute appointments, but those are telehealth appointments. So it's a mix of telehealth, 15-minute telehealth, and half-an-hour inpatient. Because when you think about it, by the time you come in, by the time you have that conversation, it's never 15 minutes, and it's pressure on the patient, pressure on the doctor to stay on time. So we've made it a way of consulting. You come in for 30 minutes. So that means you're actually seeing 13, 14 patients a day maximum. With lots of breaks, so I have a mid-morning break, a mid-afternoon break, always have a good lunch break where I can step out, get some sunlight, go for a walk, get some fresh air. And how we've sort of designed it is when you do come in for your first appointment, you've already had to go through a nice questionnaire, and it's really long. It's everything I really need to know, and plus more. So sleep, nutrition, everything I can get an idea of where your health is at. But it's a beautiful time for patients to self-reflect and go, what do I want to focus on? What do I want to get out from this consult? But more importantly, is my mindset ready? So I have mindset questions of, are you responsible for your health? Are you willing to work hard? Are you ready for change? So you're already set up to this beautiful consult rather than just walking in off the streets going, this is what I've got. What do I need to do? So the doctor's prepared, you're prepared. And I think that's an important piece of the puzzle when it comes to healthcare. So you come in, and so you can get straight into this consult. And I always want to get to know the patient, get to know their life. And you've got the luxury of time to discuss it because I've got most of your details. I don't need to go through medication, and I may clarify past medical history, but I've got a lot of your details that I can learn everything about you. So it's a beautiful time for the doctor, a beautiful time for the patient to feel listened, heard, and then go away with a management plan.
Yes, I think being heard is a kind of something really an important part of this whole thing. Also, the fact that these questionnaires, it's quite, why is a doctor asking me this question? It starts the patient thinking as well beyond, I wonder which medication the doctor's going to prescribe for me. Listen, I wondered, before we finish, I wanted to take a step back from your role as a doctor, integrative doctor, because as you've observed, we're all on this health journey through life in this modern world. What do you think the biggest challenge is for us as individuals on that journey?
of integrative medicine?
No, just on the journey of life
Oh, okay.
in our modern world. That's what I mean. Taking a step back from you. You know, you're an individual. I'm an individual. We're all going through life. But what do you think the biggest challenge is for us as individuals on that journey?
I think that's a really, really good question, Ron. I think it's a beautiful time to self-reflect and go, are we living our life aligned with our values? Are we actually living our true purpose and meaning? And are we finding meaning in what we're doing? Or are we being carried away by everyone else's desires and values? And I think when we just sit and reflect and go, this is what I really, really want to do, this is aligned with my value system, I think that's when you find true happiness. And it's always okay to say, I didn't get it right. I'm going to change my route. It's always okay to learn and grow. And I my philosophy in life is that there are no regrets. There's always lessons to learn. There's always experience, and you always look back and go, amazing, glad I experienced that. What did I learn? What's my next step? But it's taking time out to go, am I in line with where I want to go? And it's okay to dream. How often many people don't dream and don't visualize the better life, because that's what they see is what they feel that they can get. And I always believe, visionaries rule the world, visionaries lead the world, and you can also be your visionary. You can manifest, you can visualize your future. You just need to dream about it.
Well, Shami, that's a great note for us to finish on. And thank you so much for joining us and sharing your journey with us today and your philosophy of healthcare. Thank you.
Amazing. Thank you, Ron.
Well, it's an interesting journey, isn't it? And one can only ask oneself, why aren't more doctors making that choice? It would be a win-win-win. A win for them, a win for the patient, and a win for the health system in general. But healthcare has become an industry, and the pharmaceutical approach is very much part of that industry. Good health may make sense, but it doesn't make dollars. Now, Shami practices in Melbourne, and she is the founder of the Mint Clinic in Collingwood, a suburb of Melbourne, Australia. She's also a podcaster, and her Six Hats podcast is available on all channels, and it's now viewed and listened to in over 22 countries. I'd also encourage you to join our Unstress Health community, where there is a wealth of information about the 5 stressors: emotional, environmental, postural, nutritional, and yes, dental stress. And while you're at identifying and reducing the stresses in life that have the potential to compromise our immune system and cause chronic inflammation, the common denominator in all diseases, at the same time, you can also build resilience on the website by focusing on the 5 pillars of health: sleep, breathe, nourish, move, and thought. And when we think about thought, our minds can either be our best friends or our worst enemies, and so mindset is another focus. Is your mindset a thrive mindset or a survive mindset? Your mind can either be your best friend or your worst enemy. You learn more about that and all about that in our Unstress Health community. I'd encourage you to join us. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.